into research and development. Currently, what are you working on specifically? We can talk about that.
Okay, so I think some of the most exciting things about prostate cancer that we have been fortunate to be involved is looking at new drug developments for prostate cancer. So some of the things that I've been working on is looking at genetics, so germline genetics, so genetics that have been inherited from your family that might confer a risk to the individual patient to getting prostate cancer. But also in addition to those genetics, there are drugs that could be used to target those genes that are abnormal, and so that's exciting. And increasingly we're going to be doing that more and more for men with prostate cancer. My other areas of interest is looking at new treatments, like for example lutetium PSMA, which is radiolabeled therapy directed specifically to the prostate cancer, and it hones in and confers radiation specifically to all the different sites that are expressing PSMA. I also have an interest in developing immunotherapy treatments that have been highly effective for lung and melanoma and renal cancers that have really fallen short in prostate cancer. But we need to try and understand why these cancers are more resistant to this strategy, and if we can understand why, then we can actually start to figure out how we manipulate the system so that we can actually make these treatments more effective for men with prostate cancer. So.
Okay. Now, talking about research and development, now you are doing some research on prostate cancer. What about the other types? Are people, oncologists like yourself, looking at prostate cancer saying that we can actually do more research on this, or is the focus being shifted to more prominent cancers like breast cancer, lung cancer?
Yeah, so there's definitely research ongoing in prostate cancer, but you highlight a very important issue. I think patient advocacy is less in prostate cancer. I think cancers like breast cancer are far more sexy than prostate cancer, and so it probably gets a lot of more coverage. It probably gets a lot more funding. If you see all the pink ribbons, there's lots of shampoos and hair products and various things that you buy with those pink ribbons, right? Where the community as a whole recognizes that you are donating some funds to breast cancer research. And so that advocacy is at all levels, and prostate cancer does not have that same level of footprint in terms of, generating those sorts of funds to facilitate the sort of research that has been done. But it's the same. It would be also the same for many other cancers like GBM, which is a horrible malignancy of the brain. Again, not sexy, so therefore not as much coverage.
Okay. Now, what do you think, talking about patient advocacy, what do you think would be your own opinion or strategy to actually get more patients to advocate about prostate cancer?
I think really having the interface between physicians and the patients, and also probably them as a group deciding what's important to them. Patient advocacy does occur. The Prostate Cancer Foundation groups, the prostate cancer consumer groups are around, and they do support each other, but it's more an individual support level rather than taking it to the next step, which is raising the profile. It tends to be, unfortunately, more about the individual patient experience and supporting a friend or somebody else who's going through that experience and providing them with some input about what it was like for them. So that's been, but I think it needs to go to the next level, and I think physicians have a role in taking it to the next level as well.
Okay, let's move on into focus specifically in Australia. Prostate cancer in Australia, what is the situation there, and are we looking at more men actually developing prostate cancer in Australia, and what are the numbers like?
So approximately 3,000 men die from prostate cancer in Australia each year. I can't remember whether it's 1 in 6 or 1 in 7 men will be diagnosed with prostate cancer each year, so it's actually pretty common. The incidence certainly is rising. It may be rising because we're better at picking it up, so we might be picking up some of the lower grade tumours as well, but it's certainly rising as well.
Okay. Final question for you, maybe your advice, your opinion, outlook on research on prostate cancer and prostate cancer getting more patient advocacy. What do you see happening in the next few years?
I think we're ESMO Asia, and I think it's nice to be at ESMO Asia and see the footprint of Asians contributing to understanding this disease. I think we certainly have a big role to play. It may be that whilst the incidence is higher in Europe and in the US and in Caucasian men, prostate cancer does occur in Chinese and Thai and Australians and Indians, and so really just trying to sort of understand what's happening in our own doorstep in terms of biologically is important.
Thank you so much, Dr.
Okay,
for your time.
pleasure.